All right, we are live. Paul
Hey,
Byrne, welcome back.
hey, good morning, Eric. Good to be back.
Yeah, it's
Good to
it's
be back.
always a pleasure. Always a pleasure to have
Absolutely.
you. And the material that we've kind of isolated to discuss today is really important. I want to give it a lot of time and depth on it because we're going to talk about MAHA, we're going to talk about some tariffs, we're going to talk about a lot of things. And from with your background, which I'll let you explain here in a minute, you have a very valid opinion and insights, both you and the whole team at Harrison Company with what you guys do. So let's I don't want to tease anybody anymore. Let's get into it. Maybe you just give us your background again, Paul, and then we'll dive right in.
Sure. Quick recap. Pretty much my entire career spent in the fitness business from the late 70s, but most of it with Precor, a very young Precor. I started there with one product company, $20 million head of sales and marketing. Was there for 15 years in that role, 15 years as CEO. Grew it from that 20 million to about 450 million. And I think one of the more respected brands in the industry. I retired about 10 years ago, joined Harrison Co., which is an investment bank headed up by Bill Harrison, who is a good friend and actually handled the transaction when we sold Precor to Amer Sports back in whatever that was, so 01, 02. Anyway, I just joined his company after retiring. And so it's a whole different perspective now from being somebody who was really fixed on operations and just in that world of building a company to one now that helps companies grow, either find financing or sell themselves if that's what they want to do. But that operational part of my background is really great for analyzing new companies and positioning them favorably when you take them to market. So that's my background. Lots of interest just in the industry, where it's going, high-level drivers, those kinds of things. As you know, I've written a couple of papers already. We wrote the first paper, I think, in the industry on GLP-1s back in, I think that was like 2022. We were mocked for that, saying it was going to grow the industry. We saw how that turned out. And then another paper on the explosion in strength training, which was very favorably received. We sent out over 500 copies of each of those to industry people that have requested it. So yeah, now we're talking about something we haven't written a paper on yet, MAHA, but I think it's really an exciting subject, one that's going to be a super positive high-level driver of the industry. And let's see where it goes. Kick me off with a good question.
Yeah. Well, it is really exciting, and it's also controversial, right? Just like anything nowadays is, people have very strong opinions. And I think one of the biggest struggles, and you and I were just talking about this in recording, is people, don't have a lot of time anymore to personally research these things, right? And B, we don't really know where to get trusted information about these things. So it's like, opinions fly, and we tend to hear it from a neighbor or a friend or a family member. And then that kind of solidifies our opinion, and then blah, blah, blah. Then we're not really having good discussions anymore about the opportunity. And I think that's what I want here is like, when people listen to this, I want you to just take your political affiliation aside. Think about the health of our country, the health of your children, the health of our industry. And let's look at it from that perspective. And I think we can have a really nice open conversation about where this can go for us. So let's start with that. I mean, you mentioned something to me that made me do some more research on this, was like the key players in the MAHA movement, the Make America Healthy Again. And we're seeing a lot of, I did a recent interview that was published with Athletech Unscripted, along with Eddie Hertzman. We interviewed Anthony Geisler, and, he talked about his opinions on that, which I thought was really interesting. And one of the things he mentioned was like, we're seeing a lot of also private industry players come into the political sphere, not necessarily getting paid to do it, but it seems like they feel compelled that now is the time where we can finally course correct, how our country's health is going, because it's not good. So maybe let's start with that. Like, what do you know about the health of our country at this point, and how can you describe that to our audience?
Well, it's not good. 2 words. It's not good. I mean, you have 60% of the country that has this chronic diseases, right? 70% is overweight or obese. Let's just start there. It's not good. And that's why these appointees, I think, are all super favorable, because this is what they're focused on. Bhattacharya, Markey, RFK Jr., what do you think about him? He's all about getting people healthy, kind of root cause analysis. Where does it come from? Lack of exercise, poor diet. That's it in a nutshell.
And when you look at the MAHA movement, like what are some of the primary initiatives? Like, I know they've laid out some goals and things they want to accomplish. And right now, I believe, as we're recording, they're still in kind of their assessment and reporting phase. But what do you think are maybe the top three or four big directives that we have?
Yeah, I don't know if we're down to directives yet beyond what RFK did with dyes and banning some of those supplements, but you can certainly predict where it's going based on the background of each of these players, I think. And if you look at Bhattacharya, I think you'll see much more on the research side. He's National Institutes of Health. He's going to want to figure out cause and effect a little more clearly. So he put programs together. So I think NIH will fund on some of that. Whereas Makary is more focused on where is he? He's FDA. He's more focused on the food side of things. And if you look at his background, I can't quote precisely what he said, but something to the effect that the food pyramid was the biggest scam ever perpetrated on Americans by the government. And it's his opinion that it's that food pyramid that has led us to where we are today. If you don't, what the food pyramid is, right? But it's really based on no real science. So it was the food pyramid that said fats are bad. So we took fats out of everything. As we took it out, like I'll use an example, yogurt, you take out fat, what do you do to replace the calories and give it a little more flavor? Because flavor is carried in fat, right, primarily. Give it a little more flavor, sugar, high fructose corn syrup or sucrose. Tons of calories, empty calories. So that's taken place throughout our entire food chain, right? So way too much sugar, too little fat, totally unbalanced. And it's led to like the common feeling that, well, fat's going to give me coronary artery disease. Not true. High levels of cholesterol. No, it's inflammation that causes that. What causes inflammation? Chronic disease causes inflammation.
It is, I look back in my own life, Paul, and I was, a child, a product of the 80s and 90s. And I was a chubby little kid. And a lot of it was due to, I just distinctly remember everything in our cupboards going to fat-free, right? Like, as long as it was fat-free, I can eat as much Entenmann's, and people will laugh if they know what that is, like, as I wanted. Yeah, that's delicious.
That's right.
But it's just loaded with sugar, but it was fat-free. And it was like, well, I can eat as many bagels as I want because they're fat-free as long as I use fat-free cream cheese. And it was like all these things. I got real chubby. And if I didn't have sports, and this was all the way through college too, even as, in our athletics department, we were told, hey, low-fat diet. So we go to the dining hall, we get, same thing. It's like bagels and chicken breasts, but just loaded up with cheap carbs and no fat. And I have to imagine that also played, some role in performance in sports. But, if I didn't have sports, I would probably be obese by now. I'll just say that because that was how I learned nutrition. So I'm grateful for that. But it was very much, I just remembered so distinctly, everything was like fat-free, no fat, low fat, right? And everybody thought, my dad had a series of heart attacks during that time too. And I have to imagine it's because of the nutrition that we thought we were doing the right thing, right? So anyway, let's talk about like some of these players and maybe we start with Marty Makary, the FDA guy. Like, tell me about what that role is from your research and how he's taken a different approach.
Well, the role as head of FDA.
Mm-hmm.
Yeah, like I said, his approach is going to be much more science-based. I think one of his key, not initiatives, but tenets is to get the industry out of the FDA. So he doesn't want the food companies on the advisory committees. He wants scientists on the advisory committee. He wants to understand cause and effect as much as he can, where to focus, what to change. So that's probably his number one thing. He believes industry is a, quote, bad influence on the FDA, and they need to be more independent and more scientific with science that's repeatable. Somebody else can take that same experiment, repeat it, and you'll get the same outcomes. So it's not based on opinion. It's based on science. It's based on fact.
And I mean, if you're going to look at like the last 20 years of the FDA, I mean, is that the major faulting point for them? Was that food companies were too involved and pharmaceutical companies were too involved? I mean, that seems to be the issue. I mean, it's
that's
a lot
it.
of,
and the latter being the bigger problem, the pharmaceutical companies. I was reading somewhere, just heard this on a podcast, that the legacy media, so, we're talking ABC, NBC, Fox, MSNBC, over 50% of the advertising, it's pharmaceutical companies. 50. And so one of the things I think McCarty wants to get out is to start to prohibit advertising of drugs on TV. Now, whether it gets away with that or not, who knows? Because that's a lot of advertising dollars that would go away. But I think there's a concern that the drug companies are, driving behavior, whether it's healthy or unhealthy, and there's truth to that.
It is. It's outrageous. I mean, if you sit and watch a sports game, so I like to watch football, American football for our European listeners, like every time it's like, I don't even know what this drug is for, like this commercial that I'm watching, but all I know is the side effects are freaking awful. And, and all I see is someone dancing with a bunch of other people dancing through the street. And you're like, what is this? Like, how does this even get out there? And how is it even, does it work? It must work. Otherwise they wouldn't do it. Right. But isn't there something to like, there's only a few countries in the world that allow this level of advertising for pharmacy.
We're the only country.
I saw a little bit in Canada. Okay. I was up there a couple of weeks ago and I was watching their TV, but I saw a little bit of that. I think maybe Australia as well. But yeah, I think it's very limited.
Yeah. And I think if you Googled or whatever research you want to use to look at those diseases, and so what percentage of the population actually has that disease, I guarantee you most of those are well under 10%.
Yeah. Interesting.
Yeah.
So Jay Bhattacharya. Thank you.
Bhattacharya. Yeah.
So the NIH, I think there's a lot of people who don't really fully understand, like myself, what the NIH does and what that role is. So maybe you could, shed some light on that one.
Yeah, it's primarily a research institute. I think they're pretty significant budget. I think it's about $50 billion budget. A lot of that money is deployed externally to universities and research houses, and a much smaller portion is the research actually takes place at the NIH. I think that's about 10 or 15% of the budget. But yeah, anything having to do, obviously, with healthy living. I think if you look at what they invest in, number one is cancer, understanding cancers. That's the primary. Secondary to that, I think, is diabetes. Third is heart disease. So yeah, they're responsible for short and long-term research into all of those aspects of disease and healthy living.
And what is Jay, do you think, what changes is he hoping to bring to that now that he's at the helm?
He's very much a solid science guy. Like, he wants well-designed experiments, repeatable. He's looking for bigger leaps in understanding right now. I think one of his criticisms has been the NIH, you're just doing this incremental funding of stuff we already know about. We're going to learn a little bit more, but it's really not worth it. It's not worth the time. It's not worth the money. We need big advances. Big advances in that science will result in big advances in health.
Yeah, interesting. And then last question, I'm kind of just setting the table for our industry here, is like, in the Health and Human Services, that oversees it all. Is that correct? Is that
yes,
generally speaking?
That's correct. Yeah.
Okay.
Yeah.
Okay. So the question that most people are thinking, like, cool. All right. So we have, these initiatives that sound amazing. Like, we're going to get, really going to start to tackle the biggest problem. I think the biggest problem our country have is our health. The sheer numbers financially are staggering. What they'll do to the national debt, what they'll do to our healthcare system, everything. This is a very legitimate, immediate concern that we need to address. It's urgent. Mm-hmm. So for our industry, like, what do you think all this means? What should we be paying attention to, and where could we be taking action to play a bigger role?
Yeah. Well, let's first start maybe, another 10,000 feet up or 20,000 feet up for the industry. And I think that it's clear to me that this is like a huge opportunity. You put this on the heels of COVID, which really sensitized the country to how important healthy living is, right? I think, what's the percentage of people who died from COVID had at least one comorbidity? It was like 90%.
Yeah.
Like, off the charts, right? So people were old and fat and had diabetes. Hate to say it, but that's all true, right? So, but still, COVID sensitized people to the need for a healthier lifestyle. So already have that. We're seeing that rebound in people coming back to clubs and all that's happening. Now you put on top of that this MAHA movement where they're making the government, this is the government's agenda, healthy living, right? This is massive. I mean, this is like when I was growing up, President Kennedy, President Council on Physical Fitness. I remember in school, like we had to do the shuttlecock run. You were tested every year. Fitness was a big deal, all because of John F. Kennedy. He's really the father of our industry, actually. So it's interesting that RFK Jr. is the one that kickstarted now, or resuscitated is probably a better word. But yeah, so I think it's a big opportunity. And how that manifests itself, I think, really depends on where you're playing. Because for people that are already going to the gym, that sort of thing, I can see that people are already committed to healthy living. They may be convinced to do more. They may be convinced to buy more supplements, for instance, which I think supplements are one of the areas that's going to benefit from this. Expanding their approach to a healthy lifestyle. I think there are going to be opportunities at the youth level, and that's the area that really needs to be addressed. Because you were talking earlier. Okay, so you grew up, you ate terrible food, you were fat, but you worked out, and that was your savior. Unfortunately, now people don't work out; they eat worse foods than you ate, and they're obese or overweight at a very, very, very young age. They don't work out. There's no gym in school anymore. Sports teams, if you don't make the select team when you're, 2 months out of the womb, forget it. You're not going to make any teams. There's no place to play. The playgrounds aren't open. So that's going to be an area of opportunity. How it gets addressed, I don't know. I know that, how do you pronounce it? Oz, is it Mehmet? Mehmet.
I think it's Mehmet Oz, yeah.
Mehmet Oz. Now he's head of the Medicare and Medicaid, interestingly enough. But one of his endeavors, I know that he funds, is I think it's called Youth Corps. I'd have to double check. I think it's called Youth Corps, and it's sending young ambassadors out to schools, getting people interested and excited about a healthy lifestyle. So he's getting 17 to 18-year-old kids. They go out and they volunteer, and they go to schools and they talk about it, and they get kids excited about their bodies and how great it could be to be fit and how good it feels and the importance of it to live a long, healthy, prosperous life. So that's a small start, but I think that's an area now that should receive a lot of attention. My one concern would be, how do people make money on it? Because this is really what most people are capitalists, and they're going to they're going to migrate to opportunities that are going to be profitable.
And that got me right to my next question, which is, you see, I agree there's going to be opportunities in, I don't know if it's through education. I think of people that I know personally as like Juliet and Kelly Starrett have been very involved in, kids movement and trying to get standing desks and things like that in schools. And Jeff and Mickey Martin from Brand X Method have done a great job of educating coaches on how to work with youth and developing youth programs. It's a hard place to make money.
Yep.
And, that's a concern, is like, how do we actually, and to motivate, the private industry networks that we have, it's like, how do we get there? How do we get it where it's actually monetizing? And does that mean, federal grants and money that way? I have no idea, but do you have any theories of what that could look like?
In terms of the industry itself?
Let's talk about youth industry. Let's talk about youth fitness and health specifically. Yeah.
Okay. Yeah. So youth fitness itself, as we just discussed, I think is one of the more difficult ones.
Yeah.
Just because, as you point out, like, how do you make money? But I think one sort of obvious path would be that parents of means will focus on their kids, whether they're athletes or not. So I could envision places that aren't really training kids to be, the next major league shortstop or 3-point shooter or whatever. They just want their kid to be fit. And so I can see programs that do that after school programs of some kind for sure, because it's either that or you go back and you fund the stuff in school. And I'd say that's unlikely. To me, it's preferable, because that way everybody participates regardless of socioeconomic status. But start somewhere, start where obviously money can be made. And as I said, I think parents of children of parents that are successful and have the means, I see parents funding these kinds of these.
And there's one of the things I've noticed over the past few years is, in the wellness category, just this skyrocketing amount of products, like consumer products, food products that are all healthy, right? Environmentally friendly, all these things. So like the CPG market is really taking a hold and getting to it. I mean, a lot of these products are really expensive, let's be honest, but what you and I probably know have been in this industry so long is like good health and fitness isn't expensive, and you don't really have to pay for it. Like if you just stay more active, you walk, right? You lift a little bit of weights, you eat generally healthy whole foods, right? You get enough sleep, you focus on your community, all these things that we know, like it's hard to make money on that. It really is. Like people will pay for specific things. People like me and you probably like a nice gym. We like home fitness equipment. I like my Oura ring, but that's not the general public. So it's like, how do we as an industry, or do we even do it? We're built on passion. I was just having this conversation. Our industry is built on passion, right? But passion only lasts so long. We got to have profit after a while. Otherwise it's unsustainable. So it's like, yeah, how do we start to work ourselves in, create really valuable solutions that we can also make money on? Or do we just kind of stick to what we have and just hope that we increase percentage by percentage every year into the total available market of who goes to gyms? Like, I don't know. That's a huge question, Paul. I know you're not an oracle, but like, what do you think about this stuff? Or am I just me?
Oracle, Delphi. I agree with what you're saying. I totally agree. But it's an interesting sort of incongruity, because on the one hand, as you're talking about, look, this doesn't take much. I mean, you get a pair of sneakers, couple dumbbell TRX, but you're good to go. You're fine. But what are we doing? Like you're saying, well, we're eating with protein, creatinine, greens, gazillion other supplements, all of which are, hate to break it to you, of dubious or unknown value. Most of them. Like there's really little to no science around a lot of that stuff. And if you look at how, I don't know if it's the Center for Disease Control, or I think it's the FDA, a lot of these things fall under this garage, are generally regarded as safe. So they're not going to hurt you, but there's not a lot of science that says this is great, right? So, you look at all these recovery studios and drips and all. I mean, there's little to no valid science around any of that. Frankly, some of it can even be dangerous. If you're taking IVs of vitamins, especially fat-soluble vitamins, they can become toxic. So I'm not saying there's a big risk there, but again, of dubious value. All the supplements you take, for the most part, of dubious to little value. So, and you know how big that industry is? 50 billion. 50 billion. I mean, it's bigger than the health club. Health club memberships are what? 43 billion, something like that. 50 billion supplements. So that's a huge incentive. If you're walking into, I belong to LA Fitness, super well-run company. They have their supplements, they're for sale. They don't push them, but they sell them. Lifetime is already said that's going to be one of their next big building blocks. Supplements. So there's not a lot of proof of efficacy around any of that. That's one of the risks actually with the MAHA group, with Bhattacharya and Makari. On the one hand, they're looking for like a broader approach to health and well-being. But on the other, they're scientists, and they're saying, well, does this stuff really work? Is it efficacious? So they could put more pressure on supplement companies to prove, because right now the onus is on the supplement company to say it's safe and manufactured to safe specifications. Fox in charge of the proverbial henhouse.
Well, there isn't, it's not like they're getting double-blind placebo.
No, exactly.
Studies done on this stuff, right? And because they don't have the time and the money. Really, it's not worth it. I mean, I was going to say what I was hearing is that, Paul, we should start a future fitness supplement line. And Maybe we wait it out another year and just kind of see what happens. Because I always joke about that. I'm like, man, if I was really focused on making money, and maybe I should be, because I would definitely get into the supplement business. It just seems like there's a lot of quick, fast dollar.
It is. Some things do work. I mean, I listen to Attia and Huberman, and they're really solid science-based guys. And there's certain things that they recommend that have been shown to work in some fashion, like magnesium sulfate for sleep, glycine, same thing. So there are supplements that have been shown to be helpful. So I'm not painting us with super broad brushes. None of this works. It does. It's just, as you point out, it's really hard to do a double blind, especially on humans. It's like, what do you do? Do you put them in a cage and make sure? So if right off the bat, if it's self-reporting, hey, I did this over the past, forget. Forget. They don't know. Yeah, I did it. I took 2. I can't remember. So it's just not solid science. I mean, it's sort of directional, but it's not the gold standard.
So let me ask you this. So if you were an operator, I mean, you mentioned LA Fitness, right? Let's use them as an example because it's easy. Is there anything that you would be repositioning or changing right now to align yourself better with the initiatives of MAHA and kind of what the government is doing?
I think one of the outcomes that we should all be looking for is more people joining the party, right? So MAHA gets out there, the importance of healthy living, as we talk, parents might start sending kids. So there's this high level of awareness. So for people that haven't, quote, joined the party yet, they're going to want to go to some place that's packaged it nice and tightly for them. Here's our program. Here's our 4-week introduction. This is what it looks like. We're going to, I think like assessment should be part of that. Movement assessment, maybe body fat, body comp analysis, some baseline you can build from, and then sell it. 4-week programs, 6-week programs, show the difference. And I think once people see that they're making progress, they're much more likely to stick with it. Hey, let's make it free on Medicare. Like I go to the gym, I'm there with, early in the afternoon or late in the morning when all the other, I call them Q-tips, like me, are there. And I watch, most of them have no freaking idea what they're doing. And they're just wandering around.
Yeah, chit-chatting.
That meanwhile, the 17-year-old girls are doing deadlifts.
Yeah, I love that. That's my favorite. It's like the young women just are just crushing it in the weight room.
They're crushing it. Yep. So anyway, that would be my recommendation.
Yeah. At a macro level, my sense and my intuition is saying that fitness is evolving and becoming a specific player in this health and wellness market, right? The difference between the size of the wellness market, trillions, right? The fitness market, billions. Do you think, do you think that's happening? Do you think we're kind of getting swallowed into or actually merging into the wellness market? And then if so, what do you think that means for our industry, and how do you think it'll change over the next 10 years? What do you think it'll look like in 10 years?
So when you say merging with the wellness market,
yeah. So things like
let's define the wellness. Let's define wellness market.
Well,
what are the components?
Yeah, I think wellness, or maybe I should say health. You're looking at a lot of YMCA now has a chief health officer, right? Dr. Gloria Winters, and she's looking to be at the forefront of healthcare with maybe actually having in-house or partnerships with medical professionals where it's hey, we're actually health. We do fitness, we do weight training, we do aerobic classes, but we're actually monitoring your health for producing healthier health outcomes for our clients. And I think that's a significant change, lifetime, or what Jeff Zwiefel's doing with the Miura program. Sure, that's framed as longevity, but it's health, it's preventive health, right? So I think we're seeing that step being made. Is that something in the research and the conversations you have, do you think that's a very legitimate thing?
Well, I still think it's kind of fuzzy around what is, quote wellness. And I think you got to try to get it down to just basic building blocks. And correct me if I'm wrong, but I think we're talking about exercise. We're talking about nutrition. and we're talking about sleep, and we're talking about mental well-being.
Yes.
I think those are the components. Now, under fitness, you can drop recovery and a bunch of those other things. If you're diagramming a sentence, that would be a subplot to that. But so yes, to answer your question, is emerging? Absolutely. And I think you're seeing things pop up like functional medicine. You don't read a lot about functional medicine, but if you do, if you dig into it, you see there's companies like I think it's called Parsley Health out there, and they're all about looking at root cause analysis to diseases and ailments, which makes sense, because what would we do now if we have a disease, an ailment, we go to the doctor, we take care of the symptoms for the most part. That's what we do, like shut that, whatever that symptom is, stop it. But you don't always get to the root cause, especially when you get to things like gut health can really drive a lot of issues with inflammation and others that if you just take some Prilosec, that's not going to do it. That's not going to take care of it. So again, I think it's back to what are the components and how do we address them? I mean, if you look at Biora and what Jeff's doing, that's really cool stuff. But that's for talk about the upper 1%, right? So, a lot of us join the industry because we believe in healthy living and having it reach as many people as possible. Now, that's not to disparage what Jeff's doing. That's fantastic. And that's a wonderful company. But I think what MAHA presents is the opportunity to get more and more people in, even if it's at a very basic level. Because again, back to what you mentioned earlier, like this pretty simple stuff. Like, let's get you into moving. Let's get you eating right. Let's get you feeling better about yourself. Let's make sure you get those 8 hours of sleep. Go out and buy an Oura Ring. That's it. That's all you really need. But as we talked earlier, to get these people in that have not done it, you have to package it so it's easy. And again, I think a baseline, get them in, measure them, put a structured program together, teach them how. It's the old teach a man to fish.
Yeah, I was going to say education is so critical, and just making it approachable and meeting. I mean, this is all stuff we know already as an industry. You got to meet people where they are. And I think what's different now is, as the MAHA movement and all these, what I call like consumer wellness influencers, right? So the Hubermans, the Gary Breccas, the Dr. Gabrielle Lyon, Dr. Stacy Sims, like all these people are out there and they're becoming bigger and bigger names. Like they're big time names now. And I think that education is closing the gap a little bit of how far we have to go to meet people where they are. I think people are generally interested. I think there's more people educating themselves. And I think it's really important. I remember, when I was coaching, I would do at my gym, I would have every once in a while, once a quarter, we would do a paleo nutrition challenge, right? Because that was my indoctrination. I was indoctrinated into paleo at the time, a full believer. But I would always start with like, okay, well, who knows what a vegetable is? Like, this sounds ridiculous, but this is really the conversations I have in front of people. I'm like, yeah, I know that. Okay, who knows what a macro is? A macronutrient. And almost no hands would go up. Like, okay, great. Now I know where to start. And I think we have to assume, like, it sounds sad to say, but most people have a kindergarten level education when it comes to their nutrition, their lifestyle factors. Even I was, on a recent trip with a bunch of old friends, and we were talking about sleep. And I was like, how much sleep do you guys get? I'm like, I don't know, 5-6 hours. I'm like, you realize if you get 7, you're going to feel astronomically better. If you get 8, you're going to be an absolute all-star that day. They're like, really? It was like, oh yeah. Yeah. Like, it'll change your life. And, once I got a text message from a friend recently who's on that trip, and he's like, dude, I got 7 hours of sleep every night this week and I can do anything. I was like, yeah, it's that simple. So I don't know how to get the education out there, but I think there's a lot of very smart people. I think podcasting is leading the way for many, but I think people are searching it out. And I think that's probably one of the coolest trends that's hard to measure, but I think it's...
Yeah, I agree with that analysis. I think that right now, the people listening to Huberman and Achita, those kinds of podcasts, is people already interested in kind of self-select for that. And when they want to dig even more deeply. And, I've got a few friends whose names I won't disclose on this podcast because some of them, but like longevity is one of their main foci, right? And just, I want to live as long and as healthy as possible, which fantastic. I feel exactly the same way. But most of these friends are already pretty darn healthy and have plenty of dough and can get whatever they want. Want to get a red light therapy, go for it. 8 sleep, I'm there. They can afford all that. It's so they're listening to those podcasts. Back to your original point, how do you get the message to those other people that we want to bring into the fold of healthy living? And I'm not sure I have the answer there, other than you point out, meet them where they are. So I think from a marketing point of view, you understand that demographic. Who are these people? What's their socioeconomic status? How old are they? More importantly, how do they consume information? We did that paper on strength, and the thing that blew me away was what was driving the whole huge move towards strength. In retrospect, not very surprising at all. But podcasts, but number one, TikTok. I mean,
influencers
by far.
Yeah.
Influencers.
Was it Babes Who Lift or something like that?
Some of those like billions of hashtags. Unbelievable. Yeah. And influencer. And the scary thing about influencers is you can be an influencer and not know what the hell you're talking about. Right? You're an influencer. You're good in front of a camera, got some good music on with whatever it is you're spewing, and there you go.
Yeah. You got some nice Lulu. You're good.
Yep. And there you go. Yeah. But back to the original point, understanding how people consume their information. That's good.
Yeah. Yeah. One of the things I want to ask you is like the FIT Act, right? That's been around for a very long time.
Mm-hmm.
I don't know what to say about it anymore. I feel like it keeps every once in a while I hear about it. I'm like, oh, it's still out there. All right. Now, what do you think is different about what we've tried in the past and what is happening now? I mean, obviously it seems like the political will has lined up in a very congruous way, right? So where gives you new hope at this point versus what we've heard of the last few decades?
Well, I think this would be the most advantageous time to try to push the FIT Act through. I mean, no question. I mean, you look at us, right? So he heads up Medicare and Medicaid. Big believer in healthy living, fitness. I can see him saying Medicare is going to cover gym memberships, all baby boomers. Come on down. Right? I mean, I wouldn't be surprised. Now, it's unfortunate. I think they're doing the budget almost as we speak. And, whether they get the FIT Act, bolt that on or not, I don't know. But like I said, these are the most favorable times ever. Because before, let's face it, Ursa was swimming upstream there against a pretty strong current. Because, a lot of people looked at it and just said, well, we're just helping that industry. They want more members. They want us to pay for it. Bullshit. We're not going to do that. Now, completely different narrative. How important this is, what a big component is. We're trying to attack. This is like this is a crisis. 60% of the country has a chronic disease, and people with chronic disease are responsible for, Google me on this, but I'm pretty sure it's like 90% of healthcare costs. Diabetes alone is like 60% of healthcare costs. Right? So this is an emergency. And so it's a much better environment now to pass that than it was, like I said, 10, 15 years ago.
Yeah. It just, it baffles me too. Like, I don't care. You don't need to throw an opinion on this, Paul. I'll do it. The political landscape that we have now is like, how many people are so hardened on one side that they can't see that this is a huge opportunity. They just want to hate the people doing it. And it's like, guys, like, who doesn't want better health for our children? Who doesn't want a longer, healthier life with less sickness at the end of people's lives? Like, if you love yourself or anybody else on this planet, like, this is a huge opportunity. So, just put it aside for a second, grow up and look at the opportunity, and let's just realize this is where we're at. And this is huge.
Well, as we talked off camera earlier, RFK Jr., huge lightning rod. Right.
Oh, yeah.
And, huge. And I would say probably the majority of the people, maybe it's split 50-50, but have a less than favorable view, mainly because of his position on autism and vaccines, I would think. So in that regard, like I said, lightning rod. People right away, it's RFK. I'm not going to listen to it because everything comes out of his mouth is bullshit. The flip side argument is, what a better guy to put in charge of that, because look at all the attention it's drawn.
Yeah. Right.
Was it Ogilvy and Mather, one of the two? There's no such thing as bad publicity. So in some regards, it was a brilliant selection.
Yeah. Well, everyone keeps saying that he does crazy stuff. And I just remember distinctly, and this is, a little off target, but it's funny. So there was a story about him putting a black bear in Central Park. I don't know if you heard this one when he was, he admits he was a little crazy in his younger days, sordid past, drug issues, drinking problems, all kinds of stuff. But when I first started hearing it, I started reading it. I actually read the transcript of him saying it. And I was like, and as a guy from Montana who does some hunting, I was like, okay, well, he found roadkill, which you can legally process the roadkill. I'm like, okay, it's not that weird. And then it started to get weirder and weirder. I'm like, okay, he's a little bit of a freak, right? Like, who takes that bear and puts it behind a bicycle rack in Central Park, right? And I was like, okay, well, I can't defend that. That's just odd. But, I think you're right. Like, you got to have, and also just to stand up and take punches for like this, you got to be a little wacky, right? You can't, no sane person really wants to do that job at this point. I don't want.
Yeah. And if people want any consolation, the bottom line is, yes, he's head of he's the FDA, but he's got a huge number of people there executing that are going to be unfazed by the fact that RFK Jr. is their boss. So I wouldn't look for any dilution in services or capability. I think we're fine.
Yeah. Cool. Okay. So slight shifts towards the end here, Paul, is, I want to touch on tariffs too. There's a lot of, and for people, we are recording in May of 2020. It's really thrown the markets upside down, sideways, laterally, you name it. It's gone in every direction the past 30 days. And I think the industry is very uncertain about what's going to happen. But if you could give any sage advice to the industry right now about this period of time of tariffs, what would you say? Is it hold steady, prepare, take any drastic movement? Like what would you tell us?
Well, when you say industry, I mean, it depends on, what segment you're in, right? I would think for a club, not what you could do, hold steady. The concern would be if these linger, they go on for a year or more, it's a tax. It's a huge tax on people. So you may have people who can't afford to go to the club anymore. And if it really keeps going, and you might not want to refurbish your equipment on the same pace you did, maybe you flipped everything out every 4 or 5 years, maybe that goes to 7 because of cost. That impacts manufacturers, that their business is going to be impacted by it. So nobody wins the tariff thing. It's a tax on everybody. It just depends on where you are in the food chain.
And I would imagine if the tariffs hold, and companies that obviously ship from China or have to deal a lot of these, they're going to get hit hard on the consumer or the product side. Do you think there's going to be a lot of consolidation coming across the board this year? I mean, do you think that's going to force, a lot of transactions like in the investment banking world? What would you predict there?
That is a possibility. I think the ones at the greatest risk are the smaller companies who maybe don't have the cash cushion to basically wait this out. I mean, it's one thing to pay more from China and you bring it in and sell it for a higher price, and maybe your volume goes down, but you keep going. But if you are impacted to the degree that you're no longer at break even, which is much more likely to happen with a smaller company, I would think, then you could go out of business. And so some of those people who may be tying on cash right now might be great brands. They might be great products. It's just they got caught in this totally unexpected squeeze, and they have no other alternative than to declare Chapter 11 or to put the company up for sale, or both.
Yeah, it's going to be a wild ride. I'm hoping it's just very short term, but we'll see.
I would say more likely than not, it will be short term. Now, not that I'm a sage prognosticator, but I just think that Trump's under so much pressure now from everyone. I mean, he's got Navarro, and that's about it. I mean, the universe people really believe in what he's doing from a tariff perspective is a number less than 10.
Well, we'll see, man. It's not boring. So far, 2025 has been not boring. And that's something.
It's been fun so far.
Yeah, that's been interesting. Paul, go ahead.
No, that's fine. Go ahead.
I was just going to say thank you for joining me. And if people want to get, like, you have those reports on strength training, you have the report on GLP-1, are you going to be having a new report coming out soon? And where can people find that information?
I don't have a new one teed up quite yet. This was going to be its own report. I don't know if we'll follow through with that or not, but there are plenty of interesting areas to do deeper dives into. So I'll keep you posted.
Yeah, that'd be great. And of course, if people want to connect with you personally, what's a good way for them to do that?
So you could reach me at Harrison Co. P. Byrne, B-Y-R-N-E, at harrisonco.com. You can find me on LinkedIn. Two most simple ways to contact.
Awesome. Well, Paul, I always really appreciate your insights. Every conversation I have, I get value from it. And I think, I would urge people to really go get those reports, even if they're, now seemingly outdated, they're really not, especially the strength one. And I think you go back to what you said about GLP-1s, and people will be like, oh, wow, there's still a lot to learn here. And there's still a lot of value in those. So yeah, I would urge people to do it. And thanks so much for doing this. And, hopefully you get some good fishing in this weekend.
Not this weekend, but maybe next week.
Awesome.
Awesome. Have you been out?
Not yet, but soon. Okay. Soon. The rivers are still running a little too fast, so we'll see. Awesome.
Okay, my friend. Thank you.
Ladies and gentlemen,
appreciate it.
Paul Byrne.
Take care.